So I'm Dorie-Anna Dueck. I'm a medical oncologist here in Saskatoon. And wrong way. So my QI project was built around the difficulty that oncology patients here in Saskatoon have in obtaining timely access for management of chemotherapy and radiation-induced side effects, as well as cancer-induced side effects. So currently there are 3 outpatient resources that patients can receive their care from in Saskatoon, but unfortunately that's associated with limited access. So often our patients are directed to the emergency room, and of course the problem with that is we all know that the ER has high utilization, and that can lead to delays in treatment, reduction in the quality of life of the patient, and reduction in the patient and family-centered experience. So 56% of oncology patients presenting to the ER, the 3 Saskatoon ERs in 1 year, did not require admission to hospital. So the aim of my project was twofold. 1, to determine the utilization patterns, and 2, the presenting diagnosis for those patients who did not require admission to hospital. Is there an alternative care access that would be better served for them? Would this care access then reduce the ER burden and improve the experience of the patient, improve their care, and improve their quality of life? So 2 key points that I learned from the faculty. The first one is, do not begin a QI project with a solution as I had, because when you come in with a solution, that may not be the one that actually leads to improvement and does prevent consideration of other solutions. So keep an open mind. The second important point is quality improvement must be data-driven. Data is so critical if we want to have a meaningful improvement in healthcare. The problem then for my project was not as expected based on the data that I gathered, and I'll speak more to that at the poster presentation. So the team that you surround yourself with is so important because they understand the healthcare system, and they are really best and equipped to think of how to do a project and not why it cannot be done. And I think Albert Einstein says this best. If I had an hour to solve the problem, I'd spend 55 minutes thinking about the problem with my team and 5 minutes thinking about the solution. I was also challenged to remember the difference between quality improvement research and medical research. In fact, I still struggled with that as I was preparing for today's presentations. The QI focus is answering 3 things. What are we trying to accomplish? How will we know that a change is an improvement? And what changes can we make that will result in improvement? So quality is never an accident. It is always the result of high intention, sincere effort, intelligent direction, and skillful execution. It represents the wise choice of many alternatives. And over the past 9 months of this workshop, I have come to realize that when we have the tools to engage and communicate with our colleagues, we really can inspire them to recognize that quality improvement is the ethical responsibility of every physician and every healthcare provider. And finally, in the words of Dr. Denning from our 3rd workshop, in God we trust, and all others must bring the data. Thank you.